Good afternoon, graduates. Good afternoon, family members. Good afternoon, faculty and staff. I am delighted to be here. My congratulations to all of you. I was just tearing up as you were walking in because I remember this is such a momentous occasion. You have done well, so congratulations to you. I want to share a few remarks that will leave you with the message, if you don't get anything else, about the importance of embracing challenge. And I'm going to do this by sharing two stories. One story is going to be basically for your family and friends, and it's to answer your challenging question, what is public health? So I will tell you a story that will help us to answer that. The other story, I hope, will leave you with an empowering insight that will carry forward for the rest of your lives and your work. So, what is public health? I'm going to make a distinction between public health and clinical medicine by saying that clinical medicine concerns itself with the health of individuals, one patient at a time. Public health also concerns itself with the health of individuals, but from a collective perspective, understanding that there's information in looking at patterns of disease, in looking at the context where people live, at the systems and structures that create that context, at the history. And public health is very much involved with asking the question, why? So I'm going to share with you, it's actually, I often present it as a little cartoon animation. I call it my cliff analogy that describes different levels of health intervention so you can see where public health is in the mix. So imagine with me a person walking along, whoops, boom, they have just fallen off of the cliff of good health. Now, if that were you or somebody in your family, you would be delighted to find an ambulance there at the bottom of the cliff to speed them on to care. But if we're concerned about others who may come along this cliff, if we're concerned about community health or population health or public health, we might well ask ourselves, what else can we put in place as a health intervention besides just stationing lots of ambulances at the bottom of the cliff, right? So then somebody's going to say, I know, let's put a net halfway down because people will fall, but at least if we have a net halfway down that cliff, we'll catch them before they get crunched up at the bottom. But aha, we all also know that nets have holes in them, so some people might fall through the cracks. So we could even make that a trampoline halfway down, no holes in that. But even if we had a trampoline halfway down the cliff, we might find ourselves with lots of people just bouncing up and down at half functionality, not able to get back to the top of the cliff. So what else can we put in place as a health intervention? Well, let's put a fence at the edge of the cliff to keep people from falling in the first place. But you know, that's going to have to be a very, very strong fence if there's a lot of population pressure against it. So what else can we do as a health intervention? Well, we can move the population away from the edge of the cliff. Now, so far, I've described 4 levels of health intervention: an ambulance, which represents our medical care and tertiary prevention, trying to prevent the diabetes from resulting in amputations. I presented the net or trampoline. This is our secondary prevention. That's screening, right? Early detection. I've presented the fence, that's primary prevention, keeping things from happening in the first place, immunization. And I've also presented moving the population away from the edge of the cliff, which is about addressing what's now called the social determinants of health, addressing neighborhood conditions and poverty and educational opportunities. But the cliff, even as nice as that is for understanding different levels of health intervention, and public health is, of course, in all of these, so far, it has a fatal flaw, which is it doesn't yet talk about how health disparities arise. And for those of you who are family members, you may not realize that there are differences in how some groups in this country experience health versus others. There are differences by social class, by race, by region of the country. So where are the health disparities on this cliff? Well, I think we're going to leave the cliff for a minute to talk about how health disparities could arise, and then we'll come back to the cliff. And just very quickly, health disparities could arise because there's differences in quality of care by group, or maybe there are differences in access to care, or even differences in the underlying conditions of people's lives, in the exposures and opportunities. So when you think about these 3 levels at which health disparities arise, We can go back to the cliff now, the 3 levels being differences in quality of care, differences in access to care, and differences in underlying exposures and opportunities. Let's go back to the cliff. And so far, I've painted this cliff as a flat 2-dimensional cliff. But now we're going to recognize that actually, whoop, we're dealing with a 3-dimensional cliff. And there may be ambulances at all different parts of the cliff, but maybe in this part of the cliff, the ambulance is there, but it has a flat tire. So it's slow or goes off in the wrong direction. Or maybe there are no ambulances there, nor nets, nor fences. And usually at those parts of the cliff, the population is being pushed closer to the edge. So now when we think about this 3-dimensional cliff, we can see about how health disparities arise on that. The ambulance being there but having a flat tire, that's differences in quality of care. The no ambulance, no net, no fence, that's differences in access to care. And the closer proximity of one population to the edge of the cliff, that's differences in underlying conditions and exposures and opportunities. I tell you about this cliff to say that public health has a place in all of it. Public health has a place in terms of clinics and medical care. Public health has a place in terms of trying to understand about improving neighborhood conditions, and public health has a place in trying to understand why is the cliff 3-dimensional, and why are there differences in how resources and populations are distributed along this cliff face. These things are called the social determinants of equity, and these include big systems of power, our isms, racism, sexism, heterosexism, and the like. And public health has a place in all of it, and furthermore, the public health perspective is that you have to pay attention to all of it if you're going to have any large and sustained improvements in health outcomes, and if you're going to eliminate health disparities by groups. So there it is. Did you get that? Were you with me? Okay. So that is the story for what is public health. And the challenge there is to understand your place in it, but to understand that that public health has to deal with all of it. Now, before I go to the second story, which is really going to be for the graduates, I talked about public health as being an individual versus collective perspective and asking the question why. I'd like to tell you a little bit about how asking the question why actually brought me to my place and the focus of my work on the impacts of racism on the health and well-being of the nation. Because although you didn't hear it, I was a molecular biology major at Wellesley College. I did medicine at Stanford. You know, I did epidemiology, both a Master of Public Health and a PhD in epidemiology at Johns Hopkins. I never was, you know, in anthropology or political science or sociology. I wasn't all into that. So how did I come to be having a professional focus on the impacts of racism on the health and well-being of the nation? And it actually, although I could talk to you for hours about this, it started with a why question. First, when I was in a clinical setting, why did we routinely include the race of the patient when we, as physicians, were talking to one another in the chief complaint, the summary telegraphic message that we convey to one another? And then when I was told, well, that's the best data we have in terms of a risk factor, then I went and did a PhD in epidemiology. And the question there is, why did we routinely collect data by race and document it by race without asking deeper questions, right? And then it said, I started asking, well, then what does race really measure? And through my study, understood that it's just a rough proxy for social class, rougher for culture, meaningless for genes, but that it precisely measures the social interpretation of how we look in our race-conscious society, so that the same race that a medical admitting clerk would check off for me that would become part of a health statistic is the same race that a taxi driver would notice, or a police officer, or a judge in a courtroom, or a teacher in a classroom. And that led me to understand that race was actually acting as a proxy for how racism operates on different people, and brought me to the importance of naming racism as a threat to the health and well-being of the nation. What do I mean when I say the word racism? I define racism, first of all, as a system. So I'm clear that I'm not talking about an individual character flaw, nor a personal moral failing, nor even a psychiatric illness, as some people have suggested. But I'm talking about a system of power. And a system of doing what? It's a system of structuring opportunity and of assigning value. And on what basis is the opportunity structured, and on what basis is the value assigned? It's based on the social interpretation of how we look, which is what we call race in this country. So just look at me right now. Here in Seattle, I'm clearly black. But in some parts of Brazil, I'm just as clearly white. In South Africa, I'm clearly colored. And so here I am with the same appearance, but the social interpretation of my appearance in these 3 different settings would assign me to 3 different racial groups. And furthermore, if I stayed in any of those settings long enough, my health would probably take on the outcome of the group to which I was assigned, even though I'd have the same genes in all 3 places. What are the impacts of this system of structuring opportunity and assigning value based on the social interpretation of how we look, based on race? Well, racism unfairly disadvantages some individuals and communities, and when we think or talk about racism at all in this country, that's where we go. But it becomes immediately clear that every unfair disadvantage has its reciprocal unfair advantage, so that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country. But even as we recognize that we have a system that's either unfairly disadvantaging or unfairly advantaging individuals and communities, this system is sapping the strength of our whole society through the waste of human resources. And I could give you many examples, but just one is how the blinders of racism that make us think that there's no genius in the barrios or on the reservations or in the ghettos keep us from investing in the full, excellent public education of all of our children. Thinking, well, we can get along very well, thank you, without those kids. But if we were to invest in the full, excellent public education of all of our kids, we could be doing so much better as a nation or even as a world. No. Thank you. Thank you. Now, that definition of racism that I gave you can be generalized to be a definition of any structured inequity. So you could say, what is sexism? Well, sexism is a system of structuring opportunity and assigning value based on gender, which unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of our whole society through the waste of human resources. And there are many axes of inequity going on. You know, there's race, gender, ethnicity, region, you know, disability status, and on and on and on. The story I want to share with you now is to bring home the insight, the empowering insight, that it is very hard to recognize systems of inequity that privilege you. But if you can recognize those, then you are empowered to act. What I mean by when I say it's very hard to recognize systems of inequity that privilege you, I mean it is hard for men to understand sexism. It is hard for white people to understand racism. It is hard for straight people to understand heterosexism. It is hard for Americans to understand our American privilege. So I'm going to tell you a story now that will sort of, I hope, provide an image that will stay with you about why it's hard, but also the empowerment once you have that realization. And it's just a very simple image. It's actually one of my newer stories. It's not all polished and everything, and I'm sure you guys will be able to help me with it later. But it came from my own real life experience. When I was a medical student at Stanford, I was studying late with some friends, and then we were hungry, and so we wandered out into Palo Alto to get a meal. So we went to this restaurant, we walked in, we sat down, ordered our food, food is served, and we are eating. And that's not very exciting. I'm sure that happens to a lot of you every week at least, okay? So, but as we're sitting here eating, I look up at the door and I see a sign. And the sign said, open, right? And, well, that's not remarkable either, right? And I could have just continued sitting at the table of opportunity eating with the sign proclaiming open to me. But in fact, because I knew about the two-sided nature of those signs, I realized that because of the hour, the restaurant was now closed, and there could be people just feet away from me, but on the other side of that sign, who would never be able to get in that restaurant that night. That is, it was proclaiming open to me, but closed to the others. The insight about the existence of two-sided or multi-sided signs in our society are important. It is hard when you're sitting at the table of opportunity and the sign proclaims open to not just think, why don't those people out there just come on in? Why are they complaining? Right? If you don't know it's a two-sided sign, you won't even understand the close. Now, the people on the other side of the sign know very well it's a two-sided sign because it's proclaiming close to them, and yet they see you inside eating. Once you know something about the two-sided nature of that sign, it empowers you to act in new ways. You can't just say, oh, why don't they just come on in and pull themselves up by the bootstrap? You don't even, well, What could you do? You could go talk to the restaurant owner and say, open the door. There are people outside. You know, let them in. You might even make a little more money. Or you could pass food out, or you could break through the glass. And furthermore, if you understand the two-sided nature of the science, you will stop discounting the stories and the accounts of people who tell you there are structural barriers here. If you understand that two-sided science exists, then when somebody tells you that something racist just happened, you won't say, oh, that's just a chip on their shoulder. You will understand. So, I want to close up, after telling these two stories, to encourage you to embrace challenge, both on the individual level. You guys have just embraced and met a tremendous challenge of completing your studies. When I say embrace challenge, continue to do that, I mean when somebody presents an opportunity to you and it makes your heart race and you're not quite sure, should I do the graduation speech? Should I apply to that program? Should I try to be a postdoc somewhere? You know, all of that. And it makes your heart race. Say yes. Do it. Even though it makes you say yes. Don't do it if somebody says, oh, come on, do drugs with me tonight. Don't do it if, if somebody says, let's go jump off a cliff. Don't do that. But if it's just like, if it's safe and it's just making you feel a little nervous, then do it. Because what that will do, you will be able to do it, and you'll be able to do it well, and it will give you increased confidence, increased power, increased sense of your capabilities, and it will actually expand you. So that's at the individual level. When I say embrace challenge at the collective level, especially in public health, our current challenge in public health is to achieve health equity through achieving social equity. And I have identified 3 principal barriers that we have in this country right now to really getting on board to achieve social equity. The first is that we have an ahistorical society. Okay? I can't go into detail on this. Ahistorical society, we need to start recognizing and rectifying historical injustices. The second is an inordinate focus on the individual. And the third is the myth of meritocracy. The myth of meritocracy, that if you work hard, you will make it. Well, you guys know you worked hard and you made it. And most people who've made it have worked hard, but there are many, many other people who are working just as hard or harder who will never make it because of structural barriers, and we need to understand that. That's the insight I tried to just give you. So as I send you forth with my congratulations, as I recognize that you all have the right skills, you have the right passion, and now is your time, I just say we need you. Please embrace challenge. You're up to the task. Congratulations. Thank you very much.